Good day, all. Welcome back and welcome to Sculpting the Family Through Nursing Care series. So I'm Dr. Arlene Blake McCain of ABM Medical and the Dr. Body Sculpt YouTube channel. Yes, I'm an MD. I'm a public health specialist. And I've chosen to do something through health education using the internet platform. There's a need. And I'm hoping that it reaches my people of my island, Jamaica, my island home of Jamaica, the Caribbean as well, the region, and the developing countries of the region as well. So today we will be talking about sculpting the family through nursing care. This is our first episode. And with us today, we have Ms. Jamiel Kong, and she comes with a wealth of experience. She's the assistant director of yours truly, Clinihealth Ltd. It's a nursing services company. It was established during the COVID-19 pandemic to address critical gaps in healthcare accessibility and quality in Jamaica. Ms. Kong has over 7 years of experience spanning education and healthcare leadership. She combines a strategic vision with a commitment to improving lives. Jamaica needs this. So when we speak of persons that are directors of institutions and organizations, such as yours truly, Clinihealth, persons will wonder, and why are you doing this? And what's your backative? What's your education? What's your training? So Ms. Kong she's a heavy hitter. She's a graduate of the University of the West Indies. She holds a Master's of Science in General Management and a Bachelor's of Science in Animal Biology. And this solid educational foundation has equipped her with the leadership, the analytical and problem-solving skills needed to navigate the complexities of the healthcare industry. And we know that Jamaicans that are trained in Jamaica and trained at the University of the West Indies come as heavy hitters and they're well trained. So in her role, she leads strategic initiatives, manages human resources, and oversees operations, all the while focusing on expanding the company's reach across Jamaica. And the mission of YTCH, that's yours truly, Clinihealth Ltd, is twofold. It provides compassionate professional care to clients who need it most, and to create meaningful job opportunities for nurses, often overlooked in traditional healthcare settings. So you notice with their team, they not only look at the need of the patient, they also look at the need of the employee, the need of the healthcare provider, and having the right fit in the right organization so that there's nice cohesion and a beautiful experience. We'll explore that with Ms. Kong today. So having witnessed the struggles that many persons face when accessing healthcare and the challenges nurses endure in the industry, through YTCH, Ms. Kong brings a unique perspective to the conversation. And their work aims to bridge the gaps in accessibility and convenience, ensuring that clients receive the care they deserve without the long wait and systemic hurdles of traditional institutions. So without much ado, Ms. Jamiel Kong, I welcome you to our first episode in the series, Family-Focused Healthcare in Our Developing Country. How we feel about it, how do you feel about it, and why YTCH? Why yours truly, Clinihealth?
Well, hello, and hi, Dr. Blake. Thank you for having me here. It's always a pleasure. Well, when it comes to yours truly, Clinihealth Limited, and it really alludes to what you have stated already. It's really seeing the need and trying to fill the gap. Because, when it comes to our health is something that we always need to pay attention to. And unfortunately, as the years go by, as time goes by, we always need assistance when it comes to our health. Sometimes short term, sometimes long term. And really, we want to ensure that no matter who you are, no matter where you are, no matter what you need, as long as it is related to your health, we have personnel, we have nurses that can assist you wherever you are. It's really dependent on what you need. We try our best to fill that role, to fill that gap. We come to you. It doesn't matter where you are, at home, at work, wherever it may be, and whatever you need, we're there for you.
You know, it's funny that you mentioned that. The first time I saw the logo for yours truly Clinihealth, I wish you could just put it up now. What I saw was the little nurse with this big syringe
Yes,
and an airplane. And I said,
yes,
"Ooh, I like that. It means that you guys will fly with your patients if there's a need." All
literally.
right. The question is, many will ask, why yours truly Cleaning Health? Why
Mhm.
choose yours truly Cleaning Health? It's like saying, why Jamaica for vacation? Why
Right,
yours truly Cleaning Health?
right.
Can you
All right.
expound on that?
No problem, of course. Because we try to develop a particular culture where we have a
Mhm,
team, a very strong team, a very well educated, well experienced team that is able to carry out the particular roles, to carry out the particular health roles that person needs. So I'll give you an example.
mhm,
For every nurse that does work with yours truly Clinic Health, they all have to be CPR and first aid trained. And I think that is something that we technically tend to overlook too, because knowledge is ongoing, right? And the way that we react to certain situations, to even an emergency, we're not saying it's going to happen, but what if it does? We want to know that we have a team that is able to think, right? Think with clarity, that is able to react, that is able to work under pressure, that they are
mhm,
trained, right? We focus on continuous training too. So it's not, oh,
mhm,
we're going to hire this one nurse. All right, you get the job done. No, no, no. We ensure that you get training as you come in, you get training as time goes by. We kind of
mhm,
develop certain skills that the nurses have as time goes
mhm,
by, because no matter where they go, they should be able to produce particular results to ensure that the clients, the patients, right, they're comfortable, they're receiving the care that they deserve. Because
mhm,
again, so definitely we focus on longevity, right? We
mhm,
are equipping persons to that no matter where they go, no matter where they end up, we are
mhm,
building their character, right? As a healthcare personnel, even little things that you don't think about. We're building
mhm,
we're building confidence, right?
mhm,
Where they're
mhm,
able to perform. We're building
mhm.
on little things that you learn in school, maybe a particular topic. I mean, after time pass, you don't remember much anymore, right? So we
Right,
want to solidify certain things so they are
right,
able to act. All right.
right.
That's
So now
one
that you've
thing.
mentioned that, so three things have come to my mind.
Hmm.
One, your nurses are CPR trained. Two, your management system. And three, ongoing learning. So let's talk about your management system and what it
Right.
composes of. What
Yes.
makes YTCH YTCH? I'm aware, and persons
Hmm.
will ask, but you have a Master's of Science in General Management and a Bachelor of Science in Animal Biology. What do you know about nursing? Tell us the secret
Listen.
of your team. I
Right.
know that you have a high powered, very smart, registered nurse on your team. And then
Correct.
you have other persons on your team that help to do the strategic planning and the
Hmm.
supervision of your nurses and the
Right.
continuous evaluation when they go out. So, tell me
Yes.
about your team. Tell me about your team.
Because this brings me to one word that we are big on, and that is communication, right?
Hmm.
Communicating from top down, no matter where you are, no matter what it is. We're big on you communicating. If you don't know something, you say it. If you want to learn something, you say it, right? And as you said, we have a particular backbone. We tend to build a foundation with the things that we do. So, for
Hmm.
example, you brought up that yes, we do have the registered nurse that plays an integral role in informing, in teaching, in how we go about certain procedures and policies. But we
Hmm.
also have in our backbone, right? And you will meet her in a few, which is
Hmm.
Miss Jones, who is an
Hmm.
EMT, almost 10 years of experience, right? So
Hmm.
we do have phlebotomist EMTs that are tailored in the backbone to have us deliver uh, on particulars. right, to have us deliver in no matter what field in the healthcare, we do have that backbone. And of course, you do have channels as well, right? Doctors, okay, Dr. Blake, right? You do have channels that you tend to build the foundation on. It is not just,
Mhm.
oh, willy nilly, we're going into it. No, we have to
Mhm.
build the foundation to know how to operate and how to progress.
All right.
Mhm.
So in your team, you
Mhm.
have you with this
Yes,
master's in science, solid science. Critical thinkers are scientists. So you're definitely a
most
critical
definitely.
thinker. I put that out there so persons understand what training in science means. That's one. Two,
Mhm.
you have your team leader as well, your registered nurse. We will not
Right.
mention her name just yet. We'll have her in another episode soon enough.
Right, right.
Very passionate leader. And we have your team members who are CPR trained
Yes.
and have EMT training. So, for the audience that may not understand what that means,
Mhm.
CPR means cardiopulmonary resuscitation. Those are the persons that when you hear, oh, he's fallen to the ground, sir, no response. Let's pump the chest, call the ambulance, give oxygen. These are the type of nurses that YTCH has. And I admire that about you and
Right.
about your team, and that you have continued medical education
Mhm.
through in-house training that you do,
Most
and
definitely.
you make sure that your nurses are also certified, because to have CPR training, it means that you're basic life support trained, BLS trained, and
Mhm.
that certification is offered by the American Heart Association. And of course, it's offered throughout the world and offered in Jamaica as one of those countries as well. And that is a plus, because
Yes,
it means for persons you may, and we'll talk about the children and so on, the different families you take care of, because we're talking about sculpting the family through nursing care. You
most
may have a
definitely.
child at home, and one of your nurses are in with this child at home, and that child is having a goodwill because they never had something that they didn't want to have. And this was one of the cases I saw some years ago in the intensive care
Right.
unit. I'll never forget it. This child came in, and it was such a teary moment because the caregiver was feeding the child some sausage, and the child wanted more sausage, and she had a wail. But
Yes.
while she wailed, she inhaled the other piece of sausage that was in
Mhm.
her mouth. It went into her airway.
Wow.
Now, time is life. There's only
Mhm.
3 minutes that you have to get oxygen in. Only 3 minutes. And that caregiver, with all the knowledge she had, she was not from your team, was BLS trained. She grabbed that child and rushed to the hospital. But by the time they got there, more than 3 minutes had passed. It was a tertiary
Right.
hospital they went to. 3 minutes had passed. Child had lost a lot of oxygen. By the time the child got to us at the Bustamante Hospital for Children, sadly, there was what
Right.
we call hypoxic brain injury. That means the brain is affected from lack of oxygen. So I mentioned this because your nannies, because you offer nanny care,
Yes,
if your
ma'am.
nannies and your nurses who are trained in BLS, basic life support, and this should happen right on the spot, bam, they know, okay, we've got to give this child some
Have to
CPR,
react.
because just pumping that chest gets some oxygen in while they do what they're doing on the way to the hospital, and it makes the world of a difference
Of a
in
difference,
the life
yes.
of a person. So in other words, what YTCH is doing is bringing to our own country in a very simple way, not as expensive as other parts of the world, but we're bringing first world care here, and that is good, and I'm
Most
glad to
definitely.
see that. And I commend your team for that. um, so tell me, what is it, how do you feel really about family focused healthcare?
Wow.
How do you feel about that?
Very important because I've alluded to backbone, right? You have a backbone everywhere and same place in the family as well, right?
Mhm.
You have to have those around you as your support. It is important to have persons to support you during these delicate times in which your
Mhm.
health is down,
Mhm.
right? So let's say you have family, mommy, daddy, the child. Yes, the child is sick, but you have to have that support from mommy and daddy to act, right? You have to be able to say, I am comfortable. And in that comfort, with that love, then you can flourish and you can get better. And I
Right.
know that mommy and daddy might not be so well versed in health. And
Mm-hmm.
again, that's where the nurses can come in too, right?
Right.
You pull from your resources. And of course, even if the nurses are going, they'll teach you what you
So
must do.
So what you're saying then is that you offer a nanny care service to your nursing company. Many
Mm,
times children get sick and mothers may
all the
have to
time.
stay home from work. They too can't get a sick leave because they're not sick. And that's sad, right?
It
And
is.
then the mothers become stressed and then they become sick
Yes.
themselves,
Yes.
right? So it's kind of good that you can, for the few days that the child is sick at home, instead of
Hmm.
carrying that child to work with mommy, right? Where they're going to be in another environment where they won't heal as well and then stress the mommy out at the same time because it's not so easy in the workplace. And then persons in the workplace are, depending on the workplace you're in, some persons work in a factory. Some
Yes.
workplaces are not conducive to having a child around. And then the personalities in the workplace may not be in agreement with what is happening. It's very difficult for the
Yes,
Caribbean
most
woman and
definitely.
the working woman. And so if the child needs to be out for 10 days after mom has gone to the doctor, gotten the sick leave, they can call yours truly Clinihealth, because guess what? You have well-trained nurses.
Of course.
You did background checks on your nurses as well.
Yes.
They are CPR trained and they have a RN supervisor as well, a registered nurse supervisor. And so for the 10 days, you can have care for that child at home, making sure they get the medication on time. They eat the foods that they're supposed to have, because proper food and proper
Hmm.
nourishment helps in healing. Now, I'm speaking as a physician because I have seen mothers just lose weight when the child is sick and they
Yeah.
then get sick. And the ailments that they have are far in between and really don't really have a proper diagnosis per se, except I've got arthritis, you've got arthritis. Oh, it's the joints that hurting. No, I feel a little fluid today. So
Hmm.
mom feels a little fluid, joints are hurting, or they say, and I'll put this in dialect, boy, that me no wrong with me, you know. Just not feel right. We need a break. So we know what
It
that feels
happens.
like. And really and truly, it's just that mothers are stressed. And
Yes.
so yours truly, Clinihealth, I recognize, provides that nanny
Hmm.
care service. At the drop of a hat, someone can call and they call you and you locate the nurse that is needed to fit
Right.
that
Exactly
family
so.
and that family situation, that home, that nurse with the the personality, even the right
Exactly.
age to fit that situation. So we're coming to a close of this segment about why family focused healthcare. So in segment 2, we're going to talk about how you guys make the match. What is it that you look at to determine which nurse should be placed in which home, and how? How do you make that assessment? Do you go into the home to take a look at the family? What kind of questions do you ask? And how do you make your nurses feel safe in that environment? Because the family
Yes.
as well is also assessed. So it's a two-way process.
Yes.
You've got to make sure your nurse is safe. You've got to make sure the
Hmm.
family is safe. And every day your supervisor checks in. So to conclude, for this segment, Ms. Kong, we're going to have you back again to talk a bit more. But family focused healthcare is important to the health
It is.
of the family. And I will mention the fiscal growth of the family, the health and wealth of the family. Because if mommy misses days from work, mommy cannot work. And if mommy
No.
cannot work, she loses her job. If mommy loses her job, she can't buy food. If she can't buy food, she can't feed the child. And then it just gets really bad. Same thing with dads. With dads that are very involved in the family, the same thing happens. Woman gets miserable. And when she gets miserable and stressed, I will add this part. When she gets miserable and stressed, they talk about men and their needs for joy. And when she gets miserable and stressed, and this man needs a particular thing, she says, I'm stressed and I'm tired. And then that breaks up relationships as well. I thought I'd leave it right there. So that's the importance of making sure mommy is happy. And yours truly Clinic Health can provide that support to the mother with a sick child. So mommy is not as stressed and tired while she's doing everything else. And daddy can be happy as well. So we'll close here for now. Prepare for segment 2. We'll be back.